Hey guys, it's Ted Bogert with the TED Show. Very excited to have a returning guest, the one and only Dr. Saied Shemiranei. What's up, my friend? How are you?
Hello, everybody. This is Dr. Saied Shemiranei. This is the second time. Thank you so much for having me again for the second time.
You've got a lot of great information and background, and people want to hear from healthcare. They want to hear from doctors. They want to hear what they should be doing. So tell them a little bit, before we get into that, tell them a little bit about you and your background and what you do.
Exactly. So I know the time is limited. We only have 30 minutes or even less. So I am going to go faster, with the higher.
You take your time. You take your time, my friend.
Yeah. So my name is Saied Shemiranei. As I said, my background is from Iran. Actually, my blood is from Iran, but I am here in the United States in the last 20-something years. My background actually is trauma and emergency medicine and trauma surgery, trained back home. And here I worked in emergency medicine and cardiology field for a long time. And I have a lot of experience in emergency situations, anything that deals with emergency in emergency room, in the hospital, in emergency setting, and medicine. So basically, I am here in Orlando in the last 2 years. I love it. I love Central Florida. This is the best place to be. Actually, the best place to raise kids and have family, with a lot of offers from society for your family and your kids.
Yes.
Unfortunately, with the Corona and COVID-19 issues, everything is slowed down. Hopefully, everything gets well.
Let's talk about COVID.
Exactly.
So let's talk about shutdown. So tell us what's happening now. That honestly, when I said that you were going to be on the show and I tagged you, people are like, "Can you ask him what's really happening out there right now from his perspective as a medical professional?"
Exactly. Well, I believe COVID-19 message or startup was a terror, or be honest with you, a shock for everybody in society, and everybody went through. And that was a big, shutdown, and with all these horrifying news everywhere and out there. With uncertainty and different news from different areas, social media, and all the dilemmas that we went through in the last few months. But from my perspective, as a provider, a medical provider, I would say we should not be terrified, although we have to be very, very cautious, and we have to take all the measures with sanitations and everything. That does not have anything to do with COVID. Be honest with you, everything else can be as horrifying as COVID if we do not care about health and sanitations and stuff like that. So it's very important to care about all of these, but we have to understand COVID-19 is not a serial killer. If we know that what we are doing, and we have our distance, and we sanitize well, and we know everything about this, it's not like, okay, COVID-19 will kill everybody. No, COVID-19 is another version of a viral syndrome, as what we are dealing every year with influenza, for example. Influenza, the same situation. How many people, just Google these information, everybody can search online and see how many people would die from influenza every year. It's not like everybody gets influenza and they will die. It's not the same that everybody gets COVID-19 and they will die. I had patients that we tested them, and the test came positive, and even the patient's daughter and wife didn't get it at all. We had patients that they came positive, and they were not having, just a lot of symptoms. So I'm just saying, I'm not saying that do not care of what you do. Very cautious, but it's not like everybody should get corona and everybody should die, God forbid, from corona. More of the mortalities there are linked to underlying medical condition. And if people they have medical condition and they have a very serious medical condition that their immune system is down, so they can die from influenza, or they can die from a diarrhea, or they can die from an asthma attack or pneumonia in the hospital. And COVID is the same thing. If you get COVID and you're young and you're a fighter and your immune system has no issue, definitely it's a viral disease. You get the viral syndrome, and of course there is no treatment at this moment, like an influenza. So if you come to my office, I tested you for influenza, rapid flu test comes positive, A, B, bum, 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 medication, Tamiflu, you're home. Or you can come before the season of influenza, we give vaccine, one dose vaccine, you are good to go. Or you get flu, you get Tamiflu with medication, and you'll be okay. But unfortunate part is with the COVID, there is no exact documented medication, a pill you take for 5 days, and there is no vaccine as of yet. But the good news is that Moderna Pharmaceuticals, I'm sure you know, they already passed phase 1 and 2, and they're working on phase 3, and phase 4 is approval. And phase 3 of these vaccines or drugs is the phase that they're working on human. So they take 600 cases and they treat them, and the 600 cases, 300 placebo and 300 the actual vaccine, and they're working on this, and they're going to be done with this phase probably by end of July. And at the end of July, if it goes to the last phase, probably hopefully by August and September, which is the peak season again for viral syndrome, we will have the vaccine available for the people.
Do you think, let me ask you, do you think that we're going to see another surge? What are we facing? Because we talked a little bit before about how the numbers seem to be going up.
I think it's going up, and I'm very, very unhappy about this. Florida was one of the states that we went down to 350 case per day, which is called incidence in the epidemiology. So the incidence of the disease went down to 360. And when that happened, everything was quarantine, and there were a lot of restrictions still. And at that moment, compared to the other state, the day that we had 360 incidents of COVID per day, for example, in California, the incidence rate was 4,000. So we were 300 and California was 4,000 on that day. But now, since all the restriction is over and there is no official restriction anymore, the peak went up to 2,000 something incidents a day in the last 2 days, versus California stayed on 4,000 incidents for that specific day, comparison to state of Florida. But today it went down dramatically, thank God, in the state of Florida, that I see the trend of the scope is going downward the hill. So I check, be honest with you, the very first thing I wake up in the morning next to my bed, I'm checking the corona update in the CDC website for physician to see what's going on. And that's the funny part. That's the very first thing I check every day. It's going down. Hopefully it stays down, but it went up in the last few days, I would say 8 times more than a week ago. So I don't know, maybe this is another warning for this, for our community. People in Florida, probably they have to be more careful. Please have this little sanitizers in your pocket everywhere you go touch. You just sanitize I go house, I open the doorknob, I go inside, I do like this, I sanitize and walk
You're a
in.
good medical professional. You do that. I think.
I know, but yeah, please, everybody should be very careful to the fact that we pass this phase, at least to have vaccine available, at least we have some sort of medication available out there, and then
Do
that
you
will be.
think? Do you think people are gonna? Do you think the government's gonna go back and put restrictions? Or are we pretty much good for now?
I think the restriction does not mean anything. The only thing is people, they have to restrict themselves. I want the people to make sure if they feel any symptoms or they feel a little bit of fever, immediately go to the people that they do test. Or center, we do test. I do offer IgG testing from the blood, which is very good and it's very accurate. Also, we offer PCR testing in our office. I would not recommend anybody with active phase or active symptoms to come to my office, because the test result in the office takes a day or so, but in the hospital they do it immediately. So I would rather test people that they think that they are exposed in the past or they had and they are cured, so they can get at least a result in their hand. So we are offered the antibody testing in the office.
Awesome.
So that's one. Everybody.
What about? Let me ask you. What do you think is going to be the norm? Is the norm going to be we're going to have a flu season and a COVID season coming up? Like, are we always going to be dealing with COVID now, like we deal with
the viral syndrome? Yeah, the viral syndrome category. The viruses that they deal with their respiratory tract and upper respiratory tract and upper respiratory tract infections would be categorized as flu season, probably matching with the same COVID season from now on. And hopefully people, they can get a vaccine and get vaccinated for both when the vaccine comes out for both, and then go through the season and hopefully
we'll have seasons. All right, we have two questions, my friend. The first one is, what do you think? Do the masks help?
The mask will help if there is any direct droplet. The COVID would not be transferred if you talk to somebody in an open air within few feet apart, of course. But if the person is sneezing on you, sneezing is like a pressurized air coming out. Coughing is a pressurized air coming out, but talking like this is not a pressurized exhale. So if you have mask, for sure, if there is any droplets in around you, it can help. N95 is the approved mask. It's available. People, they can buy it. If you want to be 100% secured, N95 would do it. Even you can go to an airplane. It's a good time to travel, my friend. If you put an N95 nice,
that's a scary looking mask, but a good one.
You have to make sure you have gloves on, N95, and also these are the
that was a great question, Joanna. All right, Maxine, let me ask this one for you. What about the tests I heard of that they're going to give at Walmart and Walgreens?
Yeah, I heard that they are helping the community to get tested. They do have test station everywhere, the same way we have in our office. The test would be antibody detection. Antibodies, there are two groups. Actually, there are three, but let's talk about the two main ones. We have IgA, IgG, and IgM. IgM for acute phase of any pathology. IgG is for exposure, past exposure, or immunity. And IgA is the mucosal antibody. So IgA is categorized for acute phase if somebody has COVID on their mucosa. So COVID testing, IgG is the one that you're looking for if you want to see if you have any exposure in the past or if there is any antibody in your body. But if you think you have symptoms, and symptoms is not necessarily fever. You remember we talked about this when CDC was saying Fever is the only indication to test people, and I will say I am not agreeing to this. I disagree, because there are viral syndrome for people that they do not have high fever, but they come with fatigue, cough, dry cough, and some sneeze and nasal congestion, only can be COVID-19. And then CDC said no, fever only. But now they announce people without fever, even they have other viral syndrome, nasal congestion, cough, and fatigue, and loss of appetite, they should be tested. This is exactly what we were practicing from day first. So now everybody with these symptoms, even without fever, they can come to the office, they can get tested, and also they can go to all these test centers that they're available throughout the state. With the help of the government and health department, they get tested. And there is another test that is the famous nasal or pharyngeal swab. It's very uncomfortable. They put the swab in your nose or down in the pharynx.
Yeah, that didn't look so fun.
Yeah, and then that is PCR, and that detects the virus genome. That is a very, very accurate test. We do this in the office as well, but people, if they do have symptoms, acute symptoms, and they come to the office, we do not accept them in the office. We still have that drive-through testing system for people with active symptoms. They come to the to the parkway, the drive-through, the parking in the back, and then we all equipped with the PPEs, the personal protective equipment, and then the nurse goes to the back and do the testing while they are in their car. So that is available, and the blood test is available in the office.
So how do people find you? Because I'm getting questions about. All right, so we'll begin to wrap it up, guys. So how do people, if somebody wants to come to your place, tell us the name. I have it scrolling across the bottom, and tell us how they can reach out and find out more.
Well, if anybody just put my name on the Google search engine, Shemiranei last name, downtown Orlando, it pops up. Advanced Preventive Medicine Urgent Care is the name of the practice, located at 1400 East Robinson. We are a few blocks east of Lake Eola in Robinson. 407-845-8623. Website apmuc.com. Everything on social media, Instagram, Facebook, your link, your site.
You're never going to meet a more social media guru, physician, doctor.
Exactly. So we're right there. Anybody can call, make an appointment. We make an appointment for drive-through or indoor testing for IgG. We accept all major insurance. We accept Medicare, all the commercials, PPOs, and also Medicare capitated plan like Freedom, Optimum, Blue Cross, Cigna, all these capitated Medicare patients for elderly, for our beloved one. If they are suspecting, if they had any exposure, or if they have any symptoms that we talk, we accept their insurance. They can come in, make an appointment. Other services, I just want to wrap up in a minute. Other services that we offer that's very, very helpful to know. We are a primary care facility. We are an urgent care facility. Any urgent matter like acute asthma attack, is aspiration of heart failure, cuts, lacerations, fractures, or ankle sprains, or rashes, allergy, insomnia, panic attack, anything can be considered urgent and need an urgent care visit. We are right here for you. I'm here all the time. I see the patient. I don't have any nurse practitioner or physician assistant to deal with the patient. I directly see patients myself in the practice all the time, every single visit. Also, we are dealing with medical cannabis, people that they are looking to get certified with the medical cannabis through the state with the diagnosis that approved by the state. And then we are an addiction center. I have board certification in addiction medicine also. So anybody dealing with narcotics, opioids, and they're not happy with their life, they're dealing with any drugs from the street, we can eliminate all these bad stuff from their body and give them a good life, go back to normal life. So we are here in Advanced Preventive Medicine Urgent Care, downtown Orlando, 1400 East Robinson in downtown Orlando, 407-845-8623.
There you go. The one and only Dr. Saied. What's up? All right. You were awesome, my friend. Thank you so much. When I tag the show again, I'll put all of the website information in there too, and so will the good doctor. Thank you for being on the show and sharing, my friend.
Thank you so much. Good to see you again, and hopefully
see you.
Go back to normal.
Yes, I'm ready.
Okay.
All right. Thank you. You guys have a great one.
Take care. Bye-bye.